Many of you will know he's quite a young minister, but he was actually sworn in at the age of 21, being the youngest person ever to be elected in Queensland Parliament as the member of Perinatal. He's since been the member for Warwick and then the member of Southern Downs, the seat that he stays representing today. He enjoys spending time with his family on their Yallarden property and is married to Linda and the father of 4 children. Please welcome Minister Springborg.
Thank you very much, Sue, and can I similarly commend you and the great work that the Centre for Mothers and Babies actually does as well, and to also Melissa and Beck as well. I'm not going to try your last name, but everyone knows who you are, and can I also thank very much the extraordinary organising committee that has been involved in bringing this great event together, and also the Metro North Medicare Local for their assistance and support in this, because it's extremely important. And once again, ladies and gentlemen, all very much about making sure that we have the right sorts of relationships and the right sort of coordination and the right sorts of interaction between primary and the acute care and the other support that actually goes with that. Can I acknowledge as well and thank my great friends and my parliamentary colleagues who are here today, to Kerry Millard and to Dale Shuttleworth, and also Trevor Ruthenberg I saw here a moment ago as well. It's great to be in your general part of the world as well, Trevor. To Malcolm Stamp, can I acknowledge you as the Chief Executive of the Metro North Hospital and Health Service as well, and thank you very much for the obvious work which you're doing in the area of maternal and perinatal care across this particular health service. I'm someone who is very, very passionate about this particular area, and it's something which I'm extraordinarily pleased and excited about being involved in. And what we have here, a very, very great and dynamic group of people, mostly ladies, but some men as well, who are very, very committed and very passionate in this area with regards to choices for women and making sure that we have the best available quality birthing opportunities within that particular framework for women and their children in Queensland. And of course, as was mentioned a little while ago by one of our speakers, there's a very, very, very important relationship with regards to the holistic feeling within the family as well. And some of you may have heard me talk about this before. I come from an area, a small rural area. Our first 2 children were born in our local hospital. That's no longer possible, and our last 2 had to be born somewhere else. And I have a very, very strong view and a very, very strong personal passion that we need to do much more to be able to provide those choices for women in Queensland and indeed the families that they support. And the thing which is the most fundamental rider for me is evidence and quality. Unfortunately, the wrong sort of evidence has been used or doctored or manipulated in the past to actually reduce the opportunity for women's choices. That's actually seen birthing services close in various areas, and has also seen the curtailment of the opportunities that should be properly and freely and also on a quality basis available to women. Because that's what this is all about, ladies and gentlemen, and that's my very, very strong commitment in that particular area. I'll go through some of those initiatives in a little while, and what I want to do is to keep going with regards to this great relationship that I've actually built up, of course, with the Health Consumers Queensland, the Maternity Coalition and the Centre for Mothers and Babies and other organisations throughout Queensland as we seek to provide enhanced opportunities for mums in Queensland. And indeed, I think we should be all very proud of the fact that given your extraordinarily strong, ardent and consistent advocacy, because I never ever cease to be amazed at how the Maternity Coalition is able to track me down. Must have a even better GPS or something or other. Wherever I am around my electorate, I've got advocates from the Maternity Coalition that are able to track me down in my electorate, and right around Queensland are very, very firm and strong advocates and really are pushing what they believe is the right thing, and I think in most cases that is certainly the case. And also, of course, going back to what Health Consumers Queensland does, it is about what the patient what the consumer really wants. And if we look at the fantastic evidence which has come out from the Centre for Mothers and Babies, that has provided us with the foundation to be able to do the things which we are now doing. But of course, you know, you need to champion those sorts of things, and you never ever need to take the foot off the pedal with regards to this, because otherwise we won't be able to keep those extraordinary achievements going. I also know that there is a great degree of frustration, that sometimes there are still areas of resistance or obstinacy around the place. But as I indicate to people, as we continue to build more and more evidence and more successful outcomes and more happy families and more happy mums, then of course everyone sees that success leads to more success, and success leads to more people who are happy to take up what are seen as revolutionary initiatives. And to me, they're not really revolutionary, they're just common sense, because it's about better care, it's about better options for mums, and it's about better outcomes for babies. And the evidence which we have today is by providing a broader range of birthing options for women, we actually have better outcomes. And that's not to say that from time to time we don't need more higher acute interventions. We do. I mean, and I don't think that anyone can argue against that, because whilst a birth in itself is relatively unremarkable, there are still lots of things that can go wrong along that particular journey. But having our highly qualified midwives involved, and engagement with your GP, and if need be with your obstetrician, depending upon the circumstances, then you can get the best of all possible worlds. So this is about collaboration. This is really about everyone working together as a multidisciplinary team, and not actually seeing someone as intruding or necessarily seeking to be a bigger fish in that particular puddle than what needs to be. And I think we've got to actually work a little bit more to break down some of those little professional issues that come up from time to time. And if anyone thinks that we haven't made extraordinary gains over the last century or so, just look at the facts, just look at the statistics. And I mean, it's because we do have very high quality health care, and because we've had very highly qualified clinicians, that today we have very few maternal deaths. One is too many, and we have very few deaths of babies. If you actually go back to where we were 100, 150 years ago, depending upon the situation and the intrapartum care that women receive, we're having up to 25 and 30% of women who are dying with childbed syndrome. And today we're looking at less than 10 in 100,000 women. Okay, and we've got to make sure that we keep it at those low numbers and do everything that we possibly can to drive those numbers down even further. It does concern me that when we look at other places around the world which have a similarly very highly developed system of maternal and perinatal care, that we are seeing it start to creep up and now get over 10. With regards to maternal deaths, and a lot of that is now related to chronic and lifestyle diseases. And I think that's one of our really big challenges, is how we now relate to and we engage women in making sure that their own care, their own personal care, and their own sense of mutual obligation with regards to that journey has so much to play in actually enhancing the outcomes for them as well. And in many ways, because of the high quality of care that we have available to us today, I think it also creates a situation of it's going to be perfect all the time. We know that can never be the case, but we can make it perfect a lot of the time. And that's about giving high quality choices which are actually based on evidence, and quality has always got to be the indicator and the thing that we seek to do. Recently in Queensland, very pleased to see the reopening of birthing services at Bay Desert. And this is something which you may have heard me tell this story before, but when I indicated to the department a month after becoming minister that they would be reopening that by the 1st of July 2014, it created absolute epilepsy in the place. They couldn't possibly do it, it was all too hard, all too difficult, how are we going to do this? And I said, well, you did it before. so it shouldn't be all that hard. And they said, well, we don't know if we've got enough time. I said, we'd better get to work. And guess what? They've managed to get it open perfectly well, brilliantly well. Great congratulations, great admiration to the whole team involved, 4 months ahead of that 24-month timetable. So it just goes to prove that it's able to be done.